Hello everyone, I am Dr. Reshma. So if you are preparing for any of the licensing exams after your MPPS, these videos would be helpful. And if you are watching my video for the first time, please do check out my previous videos. So today, let's get started with new sets of topics from radiology. Before going to these topics, I'll give you some idea regarding the whole topic. So I'll be starting with some congenital heart disease. So as I said, I'll give you a brief idea regarding this topic. So we can divide the congenital heart disease into cyanotic heart disease and acyanotic congenital heart disease. So cyanotic congenital heart disease means the baby will be having right to left shunt, and this results in cyanosis. And all the conditions that cause cyanosis, or all those conditions that are included in cyanotic congenital heart disease, starts with T. So it's very easy to remember. And the conditions are, one is tetralogy of Fallot, second one is transposition of great arteries, third one is TAPVR or total anomalous pulmonary venous return, fourth one is truncus arteriosus, and the last one is tricuspid atresia. Again, as I said, all these comes under cyanotic congenital heart disease. That means there will be shunt from right side of the heart to left side. Again, there are some more acyanotic congenital heart disease which is included in congenital heart disease. But today I will be talking about mostly all those conditions and X-ray findings in cyanotic congenital heart disease. So we can discuss this today. So moving on to first slide. So the first slide is X-ray finding in tetralogy of Fallot. So as I said, tetralogy of Fallot comes under cyanotic congenital heart disease. And tetralogy of Fallot, as the name suggests, it consists of 4 defects. And the 4 defects are, one is pulmonary stenosis, second one is right ventricular hypertrophy, third is ventricular septal defect or VSD, and the fourth one is overriding of iota. So tetralogy of Fallot means basically there are 4 defects. And the finding we get in chest X-ray is boot shaped heart. So all these findings are really important for your exams, and sometimes they can directly give the picture of the X-ray, or they can give you some features of tetralogy of Fallot. So basically in TOF, the baby will be presenting with cyanosis and some other additional features also. So that's about tetralogy of Fallot. Remember, the most important X-ray finding is boot shaped heart. Again, one more thing, the tetralogy of Fallot is the most common cyanotic congenital heart disease in children, okay, in general. Again, moving on to next slide. So next is transposition of great arteries, and the finding in chest X-ray is egg on string appearance. So we can just check what is transposition of great arteries. So transposition of great arteries also comes under cyanotic heart disease. That means the baby will be having a right to left shunt. Again, as the name suggests, it is just interchanging of major 2 arteries. Okay, so we know that from right ventricle usually pulmonary artery comes, and from left ventricle usually aorta arises. But in this case, or in this congenital condition, the interchanging of both these arteries occurs. That means from right ventricle aorta arises, and from left ventricle pulmonary artery arises. Okay, so that's about transposition of great arteries, and the finding we get is egg on string appearance. So you can see in this picture. Again, one more thing, this is the most common cyanotic congenital heart disease in neonatal period. Okay, so if they are asking you which is the most common one in general, we can answer it is tetralogy of Fallot. But specifically they are asking you which is the most common cyanotic congenital heart disease in neonatal period, then it is transposition of great arteries. So that's about TGA. Again, moving on to next slide. So next is total anomalous pulmonary venous return finding, chest X-ray finding. So here the finding is known as snowman appearance, or there is one more name, we can also call it as figure of 8 appearance. Again, this also starts with C, so it's very easy. That means the baby can have right to left shunt. Okay, that means the baby will be having cyanosis. So that's about total anomalous pulmonary venous return. Again, what does TAPVR means? The baby will not be having any venous return between the pulmonary vein and the left atrium. Okay, that's what happens. So remember this finding, because this finding is also very important. So these are the three things you should know in cyanotic congenital heart disease. So it's very easy. So in TAPVR, it is snowman appearance. In tetralogy of Fallot, it is boot-shaped heart. And the first one, that is in transposition of great arteries, we get the egg on string appearance. Again, moving on to next slide. So next is coarctation of aorta. Again, we didn't discuss about this coarctation of aorta. So this condition actually belongs to cyanotic congenital heart disease. Cyanotic congenital heart disease. That means it comes under congenital heart disease, but the baby will not have cyanosis. This is because here left to right shunt occurs. Okay, that's why the baby is not having cyanosis. Okay, so this coarctation of aorta comes under cyanotic congenital heart disease. There are few more conditions we can discuss in other slides. So here just remember, coarctation of aorta comes under cyanotic congenital heart disease. That means the baby won't have cyanosis, and this is because of left to right shunt. And in X-ray we have a finding which is known as 3-sign. So you can see here. Okay, so that's about coarctation of aorta. Again, what does coarctation of aorta means? There will be congenital narrowing of aorta will be there in the area of ductus arteriosus. Okay, so that is the definition of coarctation of aorta. And sometimes they can ask you with some clinical findings also. So one among the most important association with coarctation of aorta is Turner syndrome. So usually the babies or the people with coarctation of aorta will be having some features of Turner syndrome. Like they can have webbed neck, shield chest, streak ovaries. All those associated features can be seen with coarctation of aorta. So just remember, there is an association with Turner syndrome and coarctation of aorta, and this point is also very important.
Thank you.